Hi there, I'm Dr. Dana Watson. I'm a licensed clinical psychologist and also the Vice President of Quality Assurance at CHE. Today, I just want to talk for a second about anxiety and children. There seems to be more anxiety with children about going back to school or being in school than in years past. Maybe some of that has to do with COVID, their experience of being out of school, other illnesses that are going around, certainly the threat of school violence, or maybe they just don't like being away from their family and their home. Feelings of anxiety are 100% normal and should be expected during times of transition. While a lot of people think about separation anxiety as an issue that affects toddlers or preschoolers, we actually see it in much older children. Some children and even adults are more inclined to be anxious than others. And while most people experience a certain amount of anxiety or worry about normal things, sometimes the anxiety can get out of control and it can really be detrimental and disruptive socially, emotionally, physically, and academically. Some of the signs that we see in children, some of the symptoms we see in children who are experiencing anxiety are very similar to the symptoms we see in adults who are anxious. When you're worried, you often don't have an appetite, or unless you're like me and you tend to overeat when you're anxious. A lot of us have difficulty getting to sleep or staying asleep. We could be clingy or irritable. And we can have physical symptoms like headaches or stomach aches. Anxiety takes a lot of energy. So oftentimes, children and adults will just want to avoid a lot of the actual, like regular activities that they would normally do. It's important for parents to realize that attending school, even when a child is anxious, is actually very good for them, because missing school because of anxiety can take away your child's chance to see themselves get control over their anxiety. It can also prevent them from developing friendships, enjoying a successful school day, and making relationships with their teachers. And the teacher-parent relationship is so paramount to helping kids succeed in school, especially when they need to overcome extra anxious feelings. If you notice that your child is struggling academically or emotionally, I strongly encourage you to reach out to your child's teacher. You don't have to wait for a scheduled parent-teacher conference. Most of our teachers are happy to sit with you and discuss how your child is doing and share with you techniques and different types of skills they have learned over time that can help children adjust. If after a while and all of the efforts that you and the teacher put in together aren't successful in reducing your child's anxiety, it might be time to reach out to a professional for help. It's much better to intervene early than to have your child and your family struggle through a school year. Absolutely be intentional about talking to your children every day. Discuss with them how the day unfolded, what went well, what could have gone better. Share with them your thoughts and feelings as is age appropriate. Paving a pathway to communication now will help develop real communication skills that can benefit you and your child later when heavier or more pressing issues occur. At CHE, we have a team of trained professionals. They can work with you, teach you and your child coping skills, and give you the tools that you need to be successful as a parent and as a child in order to help your child overcome their anxiety and have the best school year yet. These tools, when taught young, will help them be successful their whole life through. At CHE, we are ready to talk and ready to listen.